there were a lot of problems with the old model. The phone demand was unmanageable. Patients were assessed on a first come, first served basis, not by clinical need. And I did an audit of Monday morning appointments, actually, and found that all the morning appointments were gone within 5 minutes, and then patients were told to phone back later. This obviously meant that patients were calling multiple times before getting through. And you can imagine from a patient's perspective, that would be very frustrating as well. We also did an audit before we went live of booked GP appointments and found that 50% of appointments could have been appropriately managed or more appropriately managed by another clinician at the practice or another service outside of the practice. And all of this pressure on the practice affected our staff satisfaction as well. So we moved to this new model at the beginning of August. And see, it's been running for a few months now. And so patients now, if they need something from the practice, they can submit an e-consult either on the NHS app or online, or they can phone the practice if they're unable to. We also, similar to what Neil has, we have iPads configured at the front desk for patients who walk in. And so those patients who walk in or phone will do an e-light, which is a shortened version of an e-consult with the care navigator, and then that, along with the e-consults, all come in to the smart inbox, which is monitored by our triage team, which is currently a GP and an administrator who are co-located in a room at Barnsbury, and they will then make a triage decision based on the information in the e-consult or the e-light on the same day. And the patient will hear back from the team on the same day as well. So the outcomes are usually a GP, pharmacist, nurse, physio appointment at the practice. We also have quick wins, similar to what Neil was saying, with things that are easy to close off, and the triaging GP can just do via email or via SMS. Maybe referring for investigations to a community service such as the minor eye condition service, self-care or self-referral information, or an admin task like a fit note. Next slide, please. Thanks. So before we went live, we sent out a survey 2 weeks before via SMS to patients to collect some baseline data and also notify them of the change. When we went live, we updated the practice website and put e-consult front and center so that when patients went to book an appointment online, that was what they saw. We also updated our phone system. We used the Exon Surgery Connect phone system. So we had a pre-recorded message by our clinical lead encouraging them to do an e-consult, and also explaining that if they're unable to do an e-consult, that is fine. They can come through to the care navigators, who will ask them a few questions about why they have called. And we also added in the option to press 1 to receive an SMS with a link to do an e-consult. After we went live, we had a patient participation group 2 weeks after, and we also sent another survey out to patients 1 month after go live, and we actually sent another one out a couple of weeks ago in November to collect some more patient feedback. Next, thank you. And so the phone lines, so as I said before, we rebuilt the phone lines so that patients are given the option to press 1 to receive an SMS with a link with an e-consult. We've found that about 200 patients are doing this a month, so that frees up the phones for patients who can't do an e-consult to come through, because otherwise people will probably just hold on. And and our average monthly inbound calls has reduced by about 600, which is about 20%. So big impact on the phones. Impact on staff. So we have found there's been better utilisation of other clinicians at the practice. For example, our first contact physiotherapist appointment usage has doubled since we've gone live. And we think that's because there's the GP and the triaging GP and the administrator booking in, rather than the reception team who would have just booked those sorts of patients in with a GP. This system has also enabled us to remotely close cases without an appointment. We've had about 28% of e-consults are closed off by the triaging GP. So those quick win cases, as Neil was saying before as well. Our reception team have been upskilled to care navigators. They now complete the e-light with the patient, and there's been really good feedback from our care navigators. Actually, they're really enjoying it, and it's also taken the pressure off them because the phones aren't as busy, and also they don't have the clinical responsibility of having to decide whether a patient gets an appointment or not. And we've also created a new role at the practice, which is the digital hub administrator, who is co-located with the triaging GP and working in the smart inbox.